continue with chapter 4, related with the back, and it consists of vertebral column, muscles of the back, spinal cord and meninges, medical, and we want to start with the description. Right, the back is the posterior aspect of the trunk, inferior to the neck, superior to the buttocks, region of the body where the head, neck, and limbs are attached. The back of the neck and the posterior and deep cervical muscles and vertebrae will be described. When we talk about the back, this includes the skin, the subcutaneous tissue, which is a layer of loose, irregular connective tissue consisting of fatty tissue containing cutaneous nerves and vessels, deep fascia, muscles and their vessels and nerves, ligaments and vertebral column, the spinal cord and meninges, three membranes covering the spinal cord, the ribs in the thoracic region, various nerves and vessels. The vertebral column is considered a backbone, spine, extending from the skull to the apex, which is the tip of the coccyx, forms the skeleton of the neck and back, and the main part of the axial skeleton. The axial skeleton, known as the articulated bones of the skull, vertebral column, ribs, and sternum. Most vertebral column in adults are 72 to 75 centimeters long, of which approximately 1/4 is formed by the fibrocartilaginous 4 discs, which separate and binds the vertebrae together. The vertebral column protects the spinal cord and spinal nerves, supports the weight of the body, provides a partially rigid and flexible axis for the body and a pivot for the head, plays an important role in posture and locomotion movement from one place to another. The vertebral column in an adult typically consists of 33 vertebrae arrangements in 5 regions, 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 4 coccygeal. The lumbosacral angle occurs at the junction of and is formed by the long axis of the lumbar region of the vertebral column and the sacrum. The movement or motion occurs between only 24 vertebrae, the cervical, which are 7, the 12 thoracic, and 5, which are lumbar. The 5 sacral vertebrae are fused in adults to form the sacrum, and the 4 coccygeal vertebrae are fused to form the coccyx. The vertebrae gradually becomes larger as the vertebral column descends to the sacrum, and then they become progressively smaller toward the apex of the coccyx. These structural differences are related to the fact that the successive vertebrae bears increasing amounts of the body weight as the column descends until it is transferred to the pelvic girdle at the sacroiliac joints. The vertebral column is flexible because it consists of many relatively small bones, the vertebrae, that are separated by a resilient 4 discs. The 24 cervical, thoracic, and lumbar vertebrae also articulate at synovial joints that facilitate and control the vertebral column's flexibility. Although the movement between two adjacent vertebrae is small, in aggregate, the vertebrae at 4 discs, uniting them from a column that is remarkably flexible yet necessarily rigid and protective of the spinal cord it surrounds. The shape and strength of the vertebrae and 4 discs, ligaments, and muscles provide stability to the vertebral column. The curvature of the vertebral column. The vertebral column in adults has 4 curvatures: the cervical, thoracic, lumbar, and sacral. The curvatures provide a flexible support, which means shock-absorbing resilience for the body. The thoracic and sacral, which are the pelvic curvatures, are concave anteriorly, whereas the cervical and lumbar curvatures are concave posteriorly. The thoracic and sacral curvatures are primary curvatures that develop during the fetal period. Primary curvatures are caused by differences in height between the anterior and posterior parts of the vertebrae. Take a look in your atlas. The curvatures of the vertebral column. Take a look in your atlas, the vertebral column, the spinal cord, and meninges. Take a look, right? The variations in the vertebrae. Right. Right. The cervical and lumbar curvatures are secondary curvatures that begin to appear during the fetal period, but do not become obvious until infancy. The secondary curvatures are caused mainly by differences in thickness between the anterior and posterior parts of the 4 discs. The cervical curvature becomes prominent when an infant begins to hold its head erect. The thoracic curvature results from the slightly wedge-shaped thoracic vertebral bodies. The lumbar curvature becomes obvious when an infant begins to walk and assumes the upright posture. This curvature, generally more pronounced in females, ends at the lumbosacral angle formed at the junction of L5 vertebrae with the sacrum. The sacral curvature also differs in males and females. The structure and function of vertebrae. Vertebrae vary in size and other characteristics from one region of the vertebral column to another, and to a lesser degree within each region. We ought to mention that a typical vertebrae consists of a vertebral body, a vertebral neural arc, and 7 processes. Typical vertebrae vary in size and in other characteristics from one region to another. However, their basic structure is the same. The vertebral body is the anterior, more massive part of the bone that gives strength to the vertebral column and supports body weight. The vertebral bodies, especially from T4 inferiorly, becomes progressively larger to bear the progressively greater body weight. In dried laboratory and museum skeletal specimens, the hyaline cartilage that covers most of the superior and inferior ends of the vertebral body is absent, and the bone appears spongy, except at the periphery, where an epiphyseal ring or smooth bone, the epiphyseal ring, which is derived from the annular epiphysis, fused to the body, and as the vertebrae grow, the hyaline epiphyseal plates from the zone from which the vertebral body grows in height. The epiphyseal growth plates, in addition to serving as growth zones, probably provide some protection to the vertebral bodies and permit the fusion of fluid between the foredisc and the capillaries. In the vertebral body, a secondary center of ossification appears around puberty in the margin of each growth plate, forming an epiphyseal ring from the annular epiphysis. The superior and inferior epiphyses usually unite with the vertebral column body early in adult life, approximately 25 years. And the centrum is the primarily ossification center for the central mass of the vertebral body. The terms centrum and body are not synonyms. The centrum is somewhat less than a vertebral body. The vertebral arch is posterior to the vertebral body and is the part of a vertebra that is formed by the right and left pedicles and laminae. The pedicles are short, stout processes that join the vertebral arch to the vertebral body. The pedicles project posteriorly to meet two broad flat plates of bone, the laminae. The vertebral arch and the posterior surface of the vertebral body form the walls of the vertebral foramen. The succession of vertebral foramina in the articulated column forms the vertebral canal, which is the spinal canal, which contains the spinal cord, meninges, spine, spinal nerve roots, and vessels. The vertebral notches are indentations formed by the projections of the body and articular processes above and below the pedicle. The superior and inferior vertebral notches of adjacent vertebrae contributes to the formation of four foramina, which give passage to spinal nerve roots and accompanying vessels and contain the spinal ganglia, which is also known as dorsal root ganglia. The seven processes arise from the vertebral arc of a typical vertebrae. And spinous processes projects posteriorly from the vertebral arc at the junction of the laminae and overlaps the vertebra below. The two transverse processes projects posterolaterally from the junctions of the pedicles and laminae. The four articular processes, two superior and two inferior, also arise from the junctions of the pedicles and laminae. The processes, two transverse and one spinous, project from the vertebral arch and afford attachment for deep back muscle and forms layers that help the muscle to move the vertebrae. The four articular processes project superiorly and inferiorly, respectively, from the vertebral arc and are in opposition with corresponding processes of vertebrae superior and inferior to them. Their function is to restrict movement in certain directions, or at least to the degree which movements might be permitted. The articular processes also prevent the vertebrae from slipping anteriorly. When one rises from the flexed position, the articular processes bear weight temporarily. The inferior articular processes of L5 vertebrae bears weight even in the erect posture. The regional characteristics of vertebrae in different regions of the vertebral column show some modification from typical vertebrae. The vertebrae is in each region can usually be identified because of special characteristics. Cervical vertebrae and characterized by the presence of foramina in the transverse processes. In addition, individual vertebrae have distinguished characteristics. The C7 vertebrae, for example, has a long spinous process that forms a prominence under the skin, especially when the neck is flexed. Run your fingers along the middle of the posterior aspect of your neck until you feel the prominent C7 spinous process. The direction of the articular faces on the articular processes of vertebrae determines the direction of movement of the trunk allowed in any particular region. For example, the articular faces of thoracic vertebrae favor lateral bending and rotation of the vertebral column. Variation in the size and shape of the vertebral canal occur because the spinal cord is enlarged in the cervical and lumbar region to provide innervations of the limbs. The cervical vertebrae. The cervical vertebrae form the bony skeleton of the neck. The smallest of the 24 movable vertebrae, the cervical vertebrae, are located between the skull and thorax. The cervical vertebrae are relatively small bones and bear less weight than do the vertebrae inferior to them. The distinctive features of each cervical vertebrae is the oval foramen or transverse process, which is L. foramen transversarium. This foramina are smaller in C7 than those in other cervical vertebrae. Occasionally, these foramina are absent. The vertebral arteries pass through the transverse foramina, except those in C7, which transmit only small accessory vertebral vein. The transverse processes of cervical vertebrae and laterally in two projections, the anterior and posterior tubercles. The large anterior tubercle of C6 are called carotid tubercles because the common carotid arteries might be compressed against them to control bleeding from these vessels. C3 through C7 vertebrae are characterized by large vertebral foramina because of the cervical enlargement of the spinal cord that provides from the innervation of the upper limbs. The superior borders of the bodies of these vertebrae are raised posteriorly, especially at the sides, but are depressed anteriorly. Their raised margins are uncinate processes. The spinous processes of C3 through C6 vertebrae are short and usually bifid in white people, but usually not in black people. C7 is a prominent vertebrae that is characterized by a long spinous process. Because of this prominent process, C7 is called the vertebral prominence. The C1 and C2 are atypical cervical vertebrae. The C1, the atlas, is a ring-shaped bone. The atlas is the widest of the cervical vertebrae. Because it supports the skull, it was named after Atlas, who, according to Greek mythology, supported the earth on his shoulders. The kidney-shaped concave superior articular surface of C1 received the two large protuberances at the sides of the foramen magnum, the occipital condyles. Throughout these condyles, the weight of the head is transmitted to the vertebral column. The atlas has no spinous process of body. It consists of anterior and posterior arches, each of which has a tubercle and a lateral mass. The posterior arch, which corresponds to the lamina of a typical vertebra, has a wide groove for the vertebral artery. On its superior surface, the first cervical nerve also occupies this groove. The C2, the axis, is the strongest of the cervical vertebrae because C1, carrying the skull, rotates on it when a person is shaking the head. For example, the axis has two large flat bearing surfaces, the superior articular faces on which the atlas rotates. The distinguishing feature of the axis is the blunt tooth-like dents, which is called the odontoid process, which projects superiorly from its body. The dents, which is the G tooth, is held in position by the transverse ligament of the atlas, which prevents horizontal displacement of the atlas. The C2 has a large bifid spinous process that can be felt deep in the nuchal groove, the posterior groove of the neck. The reason C1 and C2 vertebrae are atypical is because part of the body of C1 is transferred to the body of C2. The part of the body that remains with C1 is represented by the anterior arc of C1. The part of the body of C1 that was transferred to C2 becomes the dens. It is the pivot around which C1 carrying the head rotates. The thoracic vertebrae, the characteristics between the features of thoracic vertebrae are the costal faces for articulation with ribs. One or more faces are on each side of the body for articulation with the head of a rib. And one facet is on each transfer process of the superior 10 thoracic vertebrae for the tubercle of a rib. The cranial base and the first two cervical vertebrae observe the occipital condyles that articulate with the superior articular surface, which are also known as faces. Of the atlas, the C1 vertebrae, the atlas on which the skull rests, observe that it has neither a spinous process nor a body. Take a look in your atlas. The typical thoracic vertebrae, right? Take a look at the superior views of cervical vertebrae, right? The spinous processes of the thoracic vertebrae are long and slender, and the middle one are directed inferiorly over the vertebrae arches of the vertebrae inferior to them. The T1 through T4 vertebrae have some features of cervical vertebrae. T1 is atypical, and that is has a long, almost horizontal spinous process that might be nearly as prominent as that of the vertebrae prominence. T1 also has a complete costal facet on the superior edge of its body for the first rib and a demi-facet on its inferior edge that contributes to the articular surface for the second rib. The T9 through T12 vertebrae are also atypical in that they have tubercles similar to the accessory and maxillary processes of lumbar vertebrae. The middle four thoracic vertebrae are typical ones. The outline of their bodies viewed from the superior aspect is heart-shaped, and the vertebral foramina are circular. Sometimes an impression is visible on the left side of the body of the thoracic vertebrae, which is produced by the descending thoracic aorta. The lumbar vertebrae. These vertebrae are in the lower back, small of the back, between the thorax and sacrum. The lumbar vertebrae are distinguished by their massive bodies, sturdy laminae, and absence of costal faces. This large vertebrae accounts for much of the thickness of the lower trunk in the median plane. The lumbar vertebrae have massive bodies because the weight they support increases towards the inferior end of the vertebral column. The bodies of lumbar vertebrae viewed superiorly increases towards the inferior end of the vertebral column. The bodies of lumbar vertebrae viewed superiorly are somewhat kidney-shaped, and their vertebral foramina vary from oval, such as L1, to triangular, such as L5. The L5 is the largest of all movable vertebrae. It carries the weight of the whole upper body. The L5 is characterized by its massive body and transverse process. Its body is markedly deeper anteriorly before it is largely responsible for the lumbosacral angle between the long axis of the lumbar region of the vertebral column and that of the sacrum. The body weight is transmitted from L5 vertebrae to the base of the sacrum, formed by the superior surface of S1 vertebra. The hat-shaped spinous processes of lumbar vertebrae are thick and broad and point posteriorly. The articular processes of lumbar vertebrae facilitate flexion, extension, and lateral bending of the vertebral column. However, they prohibit rotation. The transverse processes project somewhat posterior-superiorly as well as laterally. On the posterior surface of the base of each transverse process is a small accessory process which provides an attachment for the medial intertransverse lumbar muscle. On the posterior surface of the superior articular process mammillary processes which give attachment to the multifidus and medial intertransverse muscles. The sacrum is a large triangular weight-shaped bone. Is usually composed of 5 fused sacral vertebrae in adults. It is wedged between the hip bone and forms the roof and posterior-superior wall of the posterior pelvic cavity. The triangular shape of the sacrum resulted from the rapid decrease in the size of the lateral masses of the sacral vertebrae during development. The inferior half of the sacrum is not weight-bearing, and therefore its bulk is diminished rapidly. The sacrum, which is the L-sacred bone, provides strength and stability to the pelvis and transmits the weight of the body to the pelvic girdle. The bony ring shaped by the hip bone and sacrum to which the lower limbs are attached. The Sacral Canal, the continuation of the vertebral canal, in the sacrum contains the nerve roots of the cauda equina, which is known L cauda tail. The bundle of spinal nerve roots arising from the lumbosacral enlargements and medullary cone, which is from the L conus medullaris of the spinal cord. The cauda equina comprises the root of all the spinal nerves inferior to L1 vertebra. On the pelvic and dorsal surfaces of the sacrum are typically 4 pairs of sacral foramina between its vertebral components for the exit of the dorsal and ventral ramming of the spinal nerves. The anterior, which is pelvic sacral foramina, are larger than the posterior dorsal ones. The base of the sacrum is formed by the superior surface of S1 vertebra. Its superior articular processes articulate with the inferior articular processes of L5 vertebra. The anterior projecting edge of the body of S1 vertebra is the sacral promontory, which is L mountain ridge, an important obstetrical landmark. The apex of the sacrum, the tapering inferior end of the sacrum, has an oval facet for articulation with the coccyx. The sacrum supports the vertebral column and forms the posterior part of the bony pelvis. The sacrum is tilted so that it articulates with L5 vertebra at the lumbosacral angle, which varies from 130 to 160 degrees. The sacrum is often wider in proportion to length in the female than in the male, but the body is often wider in proportion to length in the female than in the male, but the body of the first sacral vertebrae is usually larger in males. The pelvic surface of the sacrum is smooth and concave. 4 transverse lines on this surface of sacra from adults indicates where fusion of the sacral vertebrae occurred during childhood. The individual sacral vertebrae are connected by hyaline cartilage and separated by 4 discs. Fusion of the sacral vertebrae starts after the 20th year. However, most of the 4 discs remain C5 up to or beyond middle life. The dorsal surface of the sacrum is rough, convex, and marked by 5 prominent longitudinal ridges. The central one, the median crest, represents the fused rudimentary spinous process of the superior 3 or 4 sacral vertebrae. The S5 has no spinous process. The medial intermediate crest represents the fused articular processes, and the lateral crests are the tip of the transverse processes at the fused sacral vertebrae. The clinically important features of the fused sacral vertebrae, the clinically important features of the dorsal surface of the sacrum are inverted U-shaped sacral hiatus and the sacral cornua, which is the L torus. The sacral hiatus results from the absence of the laminae and spinous process of S5 vertebra, and sometimes is floral. The sacral hiatus leads into the Sacral Canal The inferior end of the vertebral canal. Its depth varies depending on how much of the spinous process and laminae of S4 are present. The sacral hiatus contains fatty connective tissue. The terminal filum, L. filum terminale, a connective tissue strand that extends from the inferior end of the spinal cord, the S5 nerve, and the coccygeal nerve. The sacral cornua, representing the inferior articular process of S5 vertebra, project inferiorly on each side of the sacral hiatus and are a helpful guide to its location. The superior part of the lateral surface of the sacrum looks somewhat like an auricle. L. external ear, theme of Auris ear. Because of its shape, this area is named the Auricular Surface. This surface, formed by the fusion of the costal processes homologous of ribs, is the site of the synovial part of the sacroiliac joint, located between the sacrum and ilium. During life, the auricular surface is covered with hyaline cartilage. Let us continue a little bit later with this chapter number 4. Thank you.